Hello, everyone. Let's begin our pharmacological experiment. In this experiment, we will to observe the half-life. And we have studied pharmacology. We have known half-life is a very important pharmacokinetic parameters. In pharmacology, we have known pharmacokinetics parameters refers to the constant which reflect regularity of dynamic change of drug in the body, such as absorption and elimination rate constant, volume of distribution, elimination, and half-life. These pharmacokinetic parameters may be used as index reflecting the interval regulatory of dynamic change of drug in our body. Clinically safe and effective medication rhythm, including optimal doses, interval, and route of administration is often designed as the basis of pharmacokinetic parameters. So in pharmacology, we have studied some important pharmacokinetic parameters, such as Tmax, peak time, and Cmax is the peak concentration. And we also studied the apparent volume of distribution and the bioavailability and other such as clearance. Okay, this class we will observe the half-life. At first, we should know the definition of half-life. Half-life, it indicates the time required to obtain 50% of steady state or to decay 50% from steady state conditions. And half-life means the period of time when the drug concentration reduces to one half. And the definition of half-life is the time taken for the plasma concentration to reduce by 50%, and we call this half-life. Compared to half-life, we also studied the K. K is the elimination rate constant. K reflects the eliminating rate of a drug in the body. So in pharmacology, we have studied these two techniques and divided into two kinds. The first one is first order kinetics. Most drugs use this method, and some drugs use the zero order kinetics. From this formulation, we can know in the process of drug reaction kinetics, the relation of the reaction rate and dose can expression for these formulations. And this is the first order reaction. And the feeder of first order kinetics is that drug plasma concentration in the plasma decreases at a rate proportional at all time to the drug concentration itself. The half-life described in the first order kinetics is constant. But if we use large dosage drugs, if in high doses, the elimination of some drugs changed into zero order kinetics. Because of the saturation of haptic drug metabolism enzyme, the feeder of zero order kinetics is that the rate of drug elimination is constant. The pseudo half-life is proportional to the dose. So, there are some feeders in the first order rate process. The distribution and elimination rate are direct ratio to those of concentration. Concentration time curve is exponential curve, and the curve of half-life is a straight line. The half-life of the same drug is stable, constant, and have nothing to do with doses. But in zero-order kinetics, just now we mentioned, and in pharmacology we have studied, the half-life is changing. It isn't a constant, and this is half-life. And in just now we have mentioned the definition of half-life means the period of time when the drug concentration reduces to 1/2. And we have obtained the half-life equation. Half-life equal to 0.301 and multiply 20. This 20 means the interval time. Log OD1 divide OD2. So later we will use this formulation to calculate half-life. Why we should do the test X lab and to observe the half-life? Because half-life it is a very important pharmacokinetic parameters. And we have studied the significance of half-life. To achieve expectant effect and maintain effective blood concentration clinically, repeated or continuous administration is often necessary. After the drug disposed according to first-order process administered repeatedly and continuously, the blood concentration demonstrates regular fluctuation. It is usually considered that the concentration of the steady state can be achieved after. Do you remember need how many half-lives to peak concentration, to Cmax, to the peak concentration, peak time? Yes, very good. We need 4 to 6 half-lives, 4 to 6 half-lives to the peak concentration. Clinically, some acute and fatal patients must be treated in time. And generally through the use of loading dose method, the steady state concentration, Cmax, can be achieved quickly. It means that the patients may be given a large amount of the drug, followed by a smaller maintenance dose, and the blood concentration can maintain the steady state level all the time. So when the drug is given by intravenous infusion, in order to make the blood concentration reach the steady state, reach the peak time, reach the Cmax, peak concentration, constant rate intravenous infusion can be conducted simultaneously, and we use 4 to 6 half-lives. So we have known the first significance of half-life, that we can use the drugs in clinic for some acute and fatal patients. We use 5 half-lives to the peak concentration. Okay, same with this one. The second significance, the drugs be cleared or eliminated from the body, from the blood circulation, also need 4 to 6 half-lives. So in clinic, if the patients use some drugs overdose and also need 4 to 6 half-lives, and the drugs are totally eliminated. For example, after 4 half-lives, elimination is 94% completely. And we use the drugs, and the drugs need 5 half-lives, nearly be eliminated be cleared from the blood circulation more than 98%, so be eliminated completely. The second significance of half-life. We also need 5 half-lives to eliminate the drugs. For some examples, the first one, I think each of you know the first antibiotic is the penicillin. Penicillin Z, the half-life of penicillin Z only 50 minutes. So that means penicillin Z, it is the narrow spectrum and the bactericidal agents can kill bacteria. But the drug penicillin Z, natural penicillin, is the penicillin Z. It is the short-acting. It is the short-acting, short half-life drugs. Only 15 minutes. So for this reason, in fact, in clinic, our patients should use the drug each day 2 to 4 times intravenous using to use the drug to the steady state station. For another example, digoxin. You have studied and you will study digoxin. It is one kind of cardiac glycoside. We use digoxin to treat heart failure. So in congestive chronic heart failure, we use the prototypical agent is the half-life. But we use this drug to treat heart failure, and this drug will have a serious adverse action is the cardiac toxicity induce ventricular arrhythmias, very dangerous. So we give our heart failure patients digoxin to treat heart failure, and we should use low doses digoxin. Use low doses digoxin, and you should know we need 5 half-lives to the Cmax. We need 5 half-lives will have the good therapeutic effects. So for example, digoxin, the half-life of digoxin about 36 hours. So that means we give our heart failure patients digoxin. We need 5 half-lives, 36 hours. So that means we need 7 days, and the drugs will have the good therapeutic effects. And that also means if we use the drugs and the drugs effects can prolong 5 half-lives, so nearly 7 days later, the drugs be eliminated from our body. So this is digoxin. Another example, we have studied CCB, calcium channel blockers, and we divide calcium channel blockers into 3 generations. The first generation, the prototypical agent is nifedipine, and we know nifedipine is the short-acting CCB. Short-acting, and the patients should use the drug nifedipine to treat hypertension or treat other disease. They should use nifedipine 3 times 1 day, TID oral administration. Compared to the first generation CCB nifedipine, we also studied the second generation CCB, such as nimodipine. Nimodipine compared to nifedipine and longer half-life. Longer half-life and the half-life about 12 hours. So the hypertension patients, they use nimodipine, and they should use the drug twice daily, BID oral administration, because their half-life be prolonged, longer than the first generation than nifedipine. And this year, we also have the third generation CCB, such as Yes, very good. Amlodipine. And in our pharmacology class, we have studied amlodipine has the longest half-life. The longest half-life, the half-life nearly 35 to 48 hours. So for our hypertension patients, they use amlodipine compared to the second generation CCB. The amlodipine have the longest half-life, 35 hours. So our patients use the drug once daily, QD oral administration because the longest half-life in CCB. Okay. Thus now we explain the significance of half-life, and it is the very important pharmacokinetic parameters. And for this reason, we can know how to use the drug and in accord with the drug's half-life. So very important for us, for medicine, for pharmacy students. Okay, so let's do the labs. The aim of this lab, we want to grasp the method of half-life. So we use this lab, and you can know each drug. We can use this method to test the half-life. And the experimental drugs includes, the first one is 10% sodium salicylate solution. Today, in this class, we will examine sodium salicylate's half-life, and it is the tested urgency. And the second one is 10% TCA, trichloroacetic acid. TCA is the drug can deposit protein from the blood circulation. So this drug, this one is the protein precipitant. Okay, next one. The third one is 10% trichloride ferric. And this drug, it is a yellow solution. And it is the chromogenic agent. And we use this one in accord with the drug's concentration. If the drug in high concentration, so and deep color, deep yellow, and low concentration, and then use this one, use this chromogenic agent, the blood turn into light yellow. Okay, so we can use this one, give different colors, and we can know the concentration of the drugs in the serum. Next one, uracil, 20% uracil solution. We have used this agent. It is the whole anesthetics. Yes, this class we will give our rabbit uracil and to anesthetize our rabbit. Okay, the last one is heparin. Do you know heparin? Yes, very good. It is one kind of anticoagulators. Yes, very good. We have studied heparin and warfarin. Warfarin only oral administration can inhibit coagulation, but heparin different from warfarin. Heparin can inhibit coagulation in vivo and in vitro. In vivo, so later we will inject intravenous infused heparin into the blood, inhibit coagulation in vivo. And later we also will insert the tubes into the arteriole. So before we insert the tube, and we should full of heparin in the tubes to inhibit coagulation in vitro. Okay, heparin. And this class, our experimental animal is rabbit, about 2 kilogram. Okay, the first step in the lab, we each group. Now let's begin our experiment. The first step, mark the tubes. So students, we divide into different groups. Now each group take a 3 centrifuge tube, and use the pen mark the centrifuge tube. Centrifuge A, B, and C. So mark it A, B, C, and then add 4 milliliter TCA in each centrifuge tube. Okay, do it. And then you also need to take 9 small tubes, and these 9 small tubes divide into 3 groups: A group, B group, and C groups. And then you also need to use your mark pen and mark it A group, A1, A2, A3, B group, B1, B2, B3, and C1, C2, C3. And these 9 tubes later we will use. And just now we finish the first step. We take 3 centrifuge tubes and also take 9 small tubes. Okay, you finish the first step, and then each group take a rabbit and weight your rabbit, and you can find about 2 kilogram, maybe 2.2, 2.3. Okay, and then you use your big injector, take 20% urination. Each kilogram we give 5 milliliter urination. So we use you could anesthetize your rabbit with 20% urination solution. Each kilogram we give 5 milliliter, and this 5 milliliter, just now is said. For example, this rabbit 2 kilogram, the body weight of this rabbit 2 kilogram. So we use 10 milliliter, take a 10 milliliter urination, and 3/4. So for this animal, for this rabbit, we get 7.5 intravenous slowly injection, and the other 1/4 we use the drug intraperitoneal injection. And how inject urination? We can watch the video. Okay. Okay, so at first take your rabbit and weight it, and then we use this razor to cut the rabbit hair, the ear hair. Cut the ear hair. Oh, and this one is the ear wing. So use alcohol, cotton, and make the ear wing expansion. You can use your fingers to press the ear wing. And this is urination, 20% urination. Just now we said, in accordance with the body weight, each kilogram we give 5 milliliter, 20% urination. And this rabbit 2 kilogram. So we extract 10 milliliter, 20% urination, and 3/4 intravenous slowly injection. So one student press the head of the rabbit, the other one inject urination. Slowly injection. If you inject too fast, to die, because inhibitory effects depressant. So cardiac depressant, maybe bradycardia conduction blockade and died. So slowly injection. And then another student you can use the cotton and to touch the eyes, and you can find the rabbit be unnecessary or isn't unnecessary. Okay. Still continuous slowly intravenous injection urination. And test the unnecessary. Oh, it's not. It isn't it isn't unnecessary. Okay, so you can use this hemostatic forceps to grab the arms or the legs of the rabbit, and you also can watch the breathing rate. The breathing rate slower, that means be unnecessary. But this rabbit, we agent the drugs it isn't enough, so we continuous inject urination. So slowly inject. Just now we mentioned use 3 methods to know your rabbit be unnecessary or is unnecessary or isn't unnecessary. The first method touch the eye, the cornea. The second method use the hemostatic forceps, the arms or the legs of the rabbit. And the third method, you can watch the breathing rate. Okay. Okay. Don't forget slowly inject. 3/4 intravenous slowly injection. So that's now 10 milliliter, 20% urination. 3/4 means the 7.5 intravenous inject. During the injection period, we use the method to know the rabbit is unnecessary or isn't unnecessary. Okay, that's now 3/4 be injected into from the intravenous infusion. And then we fix the rabbit. Fix the rabbit with the dorsal position of the rabbit rack and make its cervical part strictly and even nicely. Don't forget, we also have 1/4, 20% urination agent give the rabbit. So now you can inject the other drugs and use the intraperitoneal injection. Same with the mouse. So how to inject intraperitoneal inject the drugs? You should know lower abdominal cavity and near the middle line. So we inject the other drugs. The other drugs 1/4. So for this rabbit, nearly 2.5%. 2.5 Okay, so we inject 25%, 2.5 milliliter urine, and then just now the rabbit be anesthetized. And later we will, so just now we anesthetized our rabbit. And now you just now you fix it with dorsal position to the rabbit rack and make its cervical part strictly and even nicely. It isn't necessary to degreen because it is an acute experiment. Then we use the scissors, or we also can use the razor to cut the wall of the cervical part and discissile the skin. So we cut the rabbit hair and then cut the cervical skin about 5 centimeter long from the thyroid cartilage according to the anteromedian line. So open the skin in the middle of the neck, and then you can find a, a, a layer, expose the fascia, seal the rabbit's hair off the neck with a razor. After that, you could find the carotid cyst beside the trachea and separate the artery about 3 to 5 centimeters from the concomitant white vagus nerve with hemostasis. Okay, let's watch the video. So now let's do the second step. Just now we anesthetize our rabbit, and then we want to do the surgery for our rabbit. In this lab, we will use this such as cottons. So we will use this. Just now we mentioned the centrifuge tube and pipes, small tubes. And here are surgical instruments, include the hemostatic forceps, large scissors, ophthalmic small scissors, large tweezers, and also ophthalmic this one, also tweezers, elbow hemostatic forceps. Okay, where? Okay, this one, elbow hemostatic forceps, and the surgical thread. Okay, surgical thread, hemostatic gauze, cotton balls, arterial clamp, tweezers, handle, glass hook, rabbit table, and rope used to bind the rabbits, razor. So this is the new rabbit table. Razor, okay, to cut the rabbit hair, and this thread, rope used to bind the rabbits, surgical thread, and these are hemostatic gauze cottons. Okay, we will use this. Our drugs, such as 20% urine, salicylic acid, and injectors. At first, we should take a rabbit and weight the body weight about 2 kilogram. So each group you have take the rabbit. About 2 kilogram. Okay, yes. And we give urination to an ancestor rabbit. So extract 20% urination. Each kilo 4 to 6 milliliter, and you can take 5 milliliter at first to remove the bubbles, and then use the razor to cut the urine.
这是耳源静脉。
This is marginal vein. This is
耳朵
central
背面的外缘， 用
artery.
手指轻弹，
And
仔细
use
看
your finger
注射
gently
麻醉。
and
耳源
inject
静脉
an
位置比较
ancestor.
浅，进针不要过深，
So
针头进入
the
血管
urine is
0.5
very
至
shallow.
1厘米即
So
可。注射速度一定要慢，
inject
在
the
2
drugs
至3分钟内
slowly,
完成注射。
slowly injection.
动物麻
And
醉方法包括静脉注
You
射
should
和腹
inject
腔
the
注射。
drugs in
静脉麻
2
醉
to
速度快，
3
但
minutes.
注射速度一定要慢，否则易造成麻醉意外，加速死亡。
You
腹
must
腔麻醉
inject
比较安全，
slowly.
但速度较慢。
Intravenous injection
麻醉
faster
与少
than
量干
intraperitoneal
错条
injection.
细丝
And just now I have explained we use 3 methods to know the rabbit is an ancestor. The first method, the second method, arms and legs relaxation, and this is the second method. And the third
麻
method,
醉结束后，
okay,
用棉
after
球压迫
finish,
注射部位，
after intravenous infusion,
固定，
and then intravenous injection,
加兔仰卧
and
位放于兔
and
上，
then intraperitoneal injection. So now, fix the rabbit.
头部，
Fix the
后颈
rabbit
部放于 U 型固定器
on
上，
the rabbit
用兔
table
唇勾住牙齿，
at
固定于
first
前方的弯钩上，
to fix the rabbit head, and use the thread to fix the teeth
用绳套套在
and
关节
the
上
four limbs.
后
So
固定到两
use this one to
注意
fix the arms
两上
and
向下向后
legs.
伸直，保持
Okay, the
腹部
arms should this position, and the legs to fix the legs. So at first we do the surgery. Use the razor to cut the rabbit hair from below to up, down to up, and put the rabbit hair into the cups, and the cups full of water. Okay, so you can in accord with your surgical arrow to cut the skin. After you cut the rabbit hair, and then use the white vessel to touch the skin, and one student use the hemostatic forceps, the other one. Okay, let's watch it carefully. Cut the neck skin above the 5 centimeter. This is the hemostatic forceps and should up. This is under the skin. It is the second layer. We still use scissors. and we still use large scissors to cut the second layer. So you can see no vascular, so use large scissors. 2 students. Okay. And maybe you find the rabbit feel pain, no problem, because the most painful layer is the skin you have cut. So don't give irritation again. Understand? If you have cut the skin, you couldn't give anesthetics. And the third layer, muscular layer. Just now, have you seen use the hemostasis to open the muscular layer, and the students you couldn't use scissors to cut this layer, the third layer, muscular layer. And this class we want to find the arteriole in the deep layer. So let's continue. And use your fingers, press the muscular, the skin, and then you can find this is the trachea. So near the trachea, and you can find that this looks like a white thread. It is, yes, very good, excellent. It is the vagus nerve.
向外翻，其余手指略向上顶，在气管两侧暴露颈动脉鞘，辨认颈总动脉。
This is the common carotid arteriole. Today, in our class, we want to find this carotid arteriole. And accompanied with arteriole is this white thread, is the vagus nerve. So let's separate vagus nerve from carotid arteriole. Okay, just now we do the experiment for our rabbit, and we open the skin in the middle of the neck, and then expose the fascia, and then we also open the muscular layer, and we find the vagus nerve. Okay, we have found the vagus nerve. So in this lab, just now we fix the rabbit and cut the rabbit hair. Okay, and put the rabbit hair into the cups. In the cups have some water. Okay, let's continue. So now we have found the vagus nerve and the carotid arteriole. So let's separate the common carotid arteriole. So now we have cut the skin of neck about 5 to 6 centimeter. The first layer skin, and we use 2 students do the labs. Okay, and use the large scissor to cut the skin. The second layer under the skin, we also can use the scissors because you can see no arterial, no vascular. But the third layer, muscular layer, you must use hemostasis to separate the muscular. Okay. Let's find the carotid artery again. That's now one group. Do the lab very nice. And then the second group do the lab, same lab, to separate the carotid artery. Okay. Have you seen the vagus nerve? Yes, it is the carotid artery. But the carotid artery accompanied with vagus nerve. We should separate vagus nerve from, this is vagus nerve. Separate vagus nerve from carotid artery. You find the carotid cyst beside the trachea and separate carotid artery about 3 to 5 cm from the concomitant white vagus nerve with hemostasis. Okay, so and prepare 2 threads. Prepare 2 threads. Put these 2 threads under the separated artery. One thread is near the head, the other thread near the heart, far away from head. One thread is used to ligate the carotid artery part near to the head, and the other thread is ready to fix the arterial cannula. So, and the carotid artery part near to the heart is clamped with a bulldog clamp. Here, don't forget, tie the thread near the head. Okay, tie the thread. And don't forget the other thread. Don't forget, near to the heart is clamped with a bulldog clamp. Okay, don't forget. Thus now we separated the common carotid artery. Operate and separate carotid artery. And we watched the 2 videos. We watched the 2 groups have done the labs. And we separate vagus nerve, and this is carotid artery, very deep, near the trachea, and accompanied with this white thread, vagus nerve. And just now, we put 2 threads under the separated artery. One thread is used to ligate the carotid artery part near to the head, and the other thread is ready to fix the arterial cannula. So let's watch the video, the details. Just now we watched the video. So here you must pay attention to, look carefully. This is the vagus nerve. This is the arterial, carotid artery. And why we must confirm this vagus nerve? Because near carotid artery, you can find a bigger venous. It is the carotid venous. Okay, so just now we have separated carotid artery, and then next step, we give heparin inhibit coagulation. 0.5% heparin inhibit coagulation in vivo, and each rabbit we intravenous inject 2 milliliter heparin intravenous infusion, and no matter the rabbit body weight, each one give 2 milliliter heparin inhibit coagulation in vivo. Okay, so don't forget inject heparin. This is heparin inhibit coagulation in vivo. And we also know heparin can inhibit coagulation in vitro. Later, we will insert this carotid cannula. So before we insert this cannula, we should inject normal heparin into this injector, inhibit coagulation in vitro. Don't forget, full of heparin in the three-way joint, and then we inject heparin intravenous infusion heparin. Just now we have said each one 2 milliliter heparin. From this step, we use this injector. Okay, use this injector. Let's inject heparin. Also from the ear vein. Use some cotton. You could fill the three-way pipe with heparin, normal sodium, and inject 2 milliliter of 0.5% heparin, normal sodium for each rabbit into the vein on the edge of the ear in order that the rabbit blood is not easy to coagulate, and the arterial cannula is unblocked during the experiment. Understand? You couldn't relax the clamp during the experiment. And just now we have inject 2 milliliter. Okay, inject 2 milliliter heparin inhibit coagulation in vivo. And the next step, just now inhibit coagulation, and we inject 2 milliliter heparin, and then we can insert arterial cannulation. So we have prepared two threads. One thread near the head, we have tied this arterial, and the other side near the heart, we use the clamp the arterial and prepare one thread to fix the cannula. And then you should use your eye scissors, small scissors, ophthalmic small scissors. Cut a small incision. And this small incision should near the head side. So near the head side, and we use this ophthalmic small scissors, cut a small V incision, and then we want to insert the arterial cannula. Okay, so let's do the lab. Near the head, use the eye scissors, cut a V incision, small incision, or maybe blood, and then we use the three-way joint, insert the three joint the three-way joint, just now we have full of heparin. So when we insert, can inhibit coagulation in vitro and insert the cannula into the arteriole. Just now we also prepare the second thread to fix this cannula. To fix this cannula, so fix the cannula. Okay. Clean the operation arrow. Okay. We have inserted the arterial cannula, and then we can take the blood. Okay. Have a break. Let's continue the left.